Hello, this is Royal Elizabeth. I'm back with another video. This is a nursing vlog, but I want to talk about head-to-toe assessment since I do get this every 4 hours on my unit. First thing I do when I walk into a patient's room is just writing my name on the board and introducing myself. And then after that, I'm asking a few questions, making sure that they are alert and oriented ×4. As they're answering those questions, I am inspecting the head, making sure there's no lesions, making sure the ears are symmetrical, the face is symmetrical. I'm also looking at their pupils. I'm going to shine a light in their eye, make sure they're reactive to light, make sure the pupils are equal and round. I'm looking at the eyelashes and the eyelids. Also looking at the eyelids because you want to make sure there's no drooping on one side of the face. So you want to look at their eyelids. You also want to look at when they smile, make sure that is symmetrical as well. When I am assessing their nose, I want to make sure that they are not flaring their nostrils, indicating that they may be breathing hard. When I check their mouth, I'm checking their tonsils, their tongue, their gums. I'm checking their teeth, seeing if they're missing any teeth, and making sure that their mucous membranes are moist and pink. I also check the strength of my patient's extremities, so I'm going to tell them to squeeze my fingers. I'm going to tell them to pull me close and pull me away. I'm going to go down to their feet. I'm going to tell them to push down on my hands and pull up against my hands on their feet. Then that is when I'm getting out my stethoscope and I'm going to listen to heart sounds. I'm going to make sure they have that lub-dub, that S1 and S2, and I'm making sure that their heart rate is within normal limits. After that, then I listen to their lungs. When they inhale and exhale, I'm making sure that it's equal bilaterally on their chest. I'm making sure the respiratory rate is within normal limits, and I'm also checking to see if I hear anything that's not, normal. You don't want to hear any wheezing. You don't want to hear any crackles. You want to hear just smooth, nice lung sounds. And if you don't know the different lung sounds, please YouTube that, and that would help you better understand which is normal and which is abnormal. Then after I listen to the lungs and the heart, I am going down to the abdomen and I'm listening to bowel sounds. I'm also inspecting the abdominal area, make sure it's flat, not distended, concave or convex. I will palpate the area and making sure that they're not having any pain in any area like the right upper quadrant or left upper quadrant. If so, I will page the provider. I'm also looking at hands and feet. I'm going to check the radial pulses. I'm going to check pedal pulses, posterior tibial pulses. And I'm also going to check cap refills on hands and feet, making sure they're not having any edema anywhere. Sometimes patients have generalized edema, but you want to make sure that you're specifying which area has edema on your assessment. I'm also inspecting skin, making sure there's no breakdown of the skin anywhere located on the front or the back of the body. And if so, I will chart that as well. Thank you.